Jai Jananda, everyone, and good evening. Thank you so much for joining us today for the Oshwal Wellbeing and Lifestyle webinar. This is our 14th webinar and the first one of 2022. Thank you, everyone, for joining us. And today's topic is about migraines. We'll talk about that in a minute, but I'd like to take, as we always do in these webinars at the start, so we'll take a prayer first from Jayesh Bhai. So the Navkar Mantra prayer from Jayesh Bhai.
Om Namo Arihantanam. Om Namo Siddhanam. Om Namo Ayariyanam. Om Namo Uvajjayanam. Om Namo Lo Esabvasahunam. Eso Panchanamukaro. Sabbapavapanasano. Mangalanam cha Sabbeshim. Padhamam Havai Mangalam. Arhanto Bhagavanta Indra Mahita. Siddhascha Siddhi Sthita. Acharya Jina Shasano Natikara. Pujya Upadhyayaka. Sri Siddhanta Supathika Munivara. Ratnatraya Radhika. Panchai Te Parameshtina Pratidinam. Kurvantu Vo Mangalam. Kurvantu Vo Mangalam. Oshwal Association of the UK તરફથી આપ સૌને પ્રણામ. આપ સર્વનું આરોગ્ય સુખાકારી સારી રહે અને ખૂબ સારા કાર્ય કરવાની શક્તિ દેવ ગુરુ અને ધર્મ પસાએ પ્રાપ્ત થાય એ જ પરમાત્માના ચરણમાં વંદના અને પ્રાર્થના.
Thank you, Jayesh Bhai, very much. Tomaro khub khub abar. Ajno apro topic che migraines, che ek jatnu mathano dukhawo che. અને આપણો આજનો ટોપિક ડિસ્કસ કરવા માટે આપણા સાથે આવ્યા છે હેધર એંગસ લેપન. એનું ઇન્ટ્રોડક્શન હું પછી કરીશ આ સેશનમાં. પણ પહેલા it is my pleasure to introduce Tushar Bhai, who is, as you know, trustee of Oshwal Association of the UK. So Tushar Bhai, welcome back to our webinars. And we're going to talk today about migraines. So I'm going to pass it over to you first, and then I'll introduce Heather. Thank you.
So thank you, Prof. Leppan, and thank you for the introduction. So welcome to today's webcast. Just to also add to what Prof. Leppan said, by popular demand, Dr. Heather actually joined us on a webinar which we organized a few months ago with Dr. Amit Bakai on strokes. And her specialist subject is neurology and epilepsy. So I'm not going to add any more than that because Prof. Leppan will add a bit more information about Dr. Heather with us. So welcome, Dr. Heather. I'm pleased that you're joining us today. And obviously, migraines affects a lot of people once or more in their lifetimes. So today we're going to learn a bit more about migraines. So over to you, Prof. Leppan.
Thank you so much. It's a great pleasure to be here. This is a wonderful series. Prafula, did you want to say something before I started?
Yes, I'm going to give you a proper introduction so people know a bit about you. So today's session, as I was saying, is about migraines. Migraine ek જાતનું માથાનો દુખાવો છે. ઘણા બધા લોકોને થાય છે અને ખાલી એ દુખાવો નથી, એના ઘણા બધા બીજા પણ symptoms હોય છે. So Heather is going to talk to us about migraines, the different types of migraines, the symptoms and the treatments for them. And in terms of where Heather is, what she does, Heather is actually a neurologist and an epilepsy lead at the Royal Free Hospital NHS Trust. So works out of both the Royal Free Hospital at Hampstead and also Barnet Hospital, and I think Chase Farm as well. Lead for stratified medicine for neurology for the Clinical Research Network, an eminent scientist of the year awardee in 2021, and an International Research Promotion Council past president of Clinical Neurosciences. So we are delighted to have you with us today, Heather. But before I come to you, I wanted to introduce Sahil Haria, who is our wonderful case study today. And Sahil is going to talk to us first about his problems with migraines and how he manages that. Sahil, welcome to our webinar, and I'm so pleased you're able to join us. I know you're not feeling great today, so I'm going to try and come to you now and get you to tell us what this is all about and what do the migraines do to you, how do you manage them, and what is the impact of this on your life. So thank you for joining us.
Yeah, of course. So thank you very much, Prof. Leppan and Tushabai, for putting this together as well. I've been dealing with migraines for a while, and I know there's a lot of people around the world that deal with them. So I'm sure this will be useful to many people. Obviously, me being somebody that suffers with it, I hope it's relatable to many people who might be going through it and don't know how to deal with it, or can benefit from anything that I might say or any of the other speakers, including, especially Dr. Heather over here. So I think just to give you a brief background of my situation, I'll just run through sort of chronologically when it started, where I'm at now, and I'll give an idea of the things that I do to try and manage it myself, and the various different people that I've maybe spoken to, where I've been to, and the kinds of advice that I've been given so far. So to start with, I started experiencing, I guess it goes from you start experiencing headaches first, and I was getting a lot of headaches back in winter of 2018. Headaches, everybody gets. I don't think there's anybody who lives without headaches, but the frequency of them started increasing a lot more. But it wasn't noticeable at the start. Eventually started increasing throughout, I think, December 2018 into Jan 2018, and it started getting very bad at that point, where I'd be getting a lot of headaches quite frequently. We could be talking about 3 to 4 to 5 times a week. But they weren't very severe. And I think from my understanding, that's the difference between headaches and migraines, is that headaches, you may still be able to function and do your daily tasks and things that you need to do. Whereas with migraines, it's very debilitating on, your general day-to-day routine. You often find yourself just lying down a lot of the time, and that's the way that you manage it. So I went to speak to my GP, and they've, I think the first thing that they do for a lot of people is they send you off for an MRI, just to make sure that there's nothing serious going on here, nothing like a brain tumor or something as serious as that. So I had an MRI done in Feb of 2018, and everything was clear, thankfully. Going forward from that, I think at that point, I went sort of going from headaches into migraines. And at that point, my migraines were to the level of, it's very, it stopped me from doing any daily tasks that I needed to do, any daily activities. I was working obviously full time. I wasn't able to commit to the full working hours that I was required. And it eventually got to a point where, if we're going forward, let's say from Feb 2018 throughout the rest of that year, 2019, I was getting them, you could say, almost every day. And a lot of neurologists that I've met, they will generally ask you, obviously, how often are you getting them? How frequent are they? How long do they last for? And I really couldn't answer that question, because it's the case of, it could be for 3 hours at one time. It could come in the morning, it could go away, and then it could come again in the evening, or it could be for 3 to 4 to 5 days straight into a week. So that's what it was like. So fast forward, we're coming into this, we're in 2022. This is my sort of 4th year of having migraines, and I'm still suffering from it just as badly as I was before. I think the only difference is that I've probably become more tolerant to it. So it's hard at this point. It's very easy to sort of give up and just say, you know what, this is something I'm living with. But I'm confident to keep pushing and trying to find something to try and solve it. So I'll run through some of the things that I sort of I have done or am doing. I think one of the things that's most important, and I'm sure Dr. Heather will probably vouch for this as well, is you need to try and keep a food diary. It's quite important to keep a food diary of all the food that you've been eating throughout the day. Either write it down or take pictures of the food, and you can come back to it, put it in a folder, a Google Drive or something like that. What this does is it gives you an idea of the food that you've been eating, and then also with that diary, try and write in the kind of side effects that you experience in that day, your mood, your behavior, and then you sort of match it up with the food that you've been eating. Full disclosure, I don't keep a food diary all the time. It takes a lot of discipline to try and keep this. I've been doing it on and off. It's a lot easier than it sounds, but when you're having migraines, I lie down a lot of the time. I'm just in bed. I need to shut my eyes, close the curtains, not have so much noise around me. When you get out of that, you feel some relief, but you're still so drained from the process. So adding more discipline into that structure makes it difficult. But yeah, I definitely advise trying to keep a food diary if that's something that you're going through. But as far as the things that I do for my own self-therapy at the moment, because I found that none of the medication that I've taken so far has helped me. So I do things like acupuncture, which I personally highly recommend. I can't vouch for everyone. Everyone has their own situations, but it's worked quite well for me so far. It gives you short-term relief. I don't think there's anything that cures migraines at this stage that I'm aware of anyway, but it's preventative in that sense. Since lockdown as well, the lockdown one, I really got into, I think the weather was great. Everyone was outside a lot. I got into doing a lot of breathing, meditation and yoga, the three pillars that often come together. And I found that, I've stuck with those three at least. Those three helped me a lot to calm myself down. The way that, I do the meditation and breathing, it sends various different vibrations through your head. I do things like reflexology. So all of these things, they've helped me, and I continue to do all of those things. If not on a daily basis, at least 4 to 5 times a week. That's something that I'm definitely doing. On top of that, I did find out, as a lot of my family were mentioning to me, that I do often grind my teeth a lot at night. When you grind your teeth, your jaws are clenched, and all your nerves are sort of linked, right? So it leads to your head over here and your temples, and it's so I went to see a dentist for that, and I think it's known as bruxism, if I'm not wrong. And I was given a mouth guard that fits my set of teeth. They inject something and they send you a mouth guard that's bespoke to you. So I try and wear that every night. And that that stops my jaws from clenching. And I feel like I have a better sleep when I am wearing that. So that's something else that I do. Other than that, I think often heat is a big trigger for people with migraines or people in general getting headaches. So often, a bag of peas you can put on your head to try and cool yourself down. There's a brand called Cool Aid, and they give you these sheets that you can put on your head to give you some relief. You're trying to get to sleep, you can't. It helps you cool yourself down. And the main thing I've noticed is my sinus often feels, or my nose often feels quite stuffy. So I do sinus rinses every morning, and that's pretty much without fail. That clears out, as disgusting as it sounds, it clears out a lot from your nose, and it makes it actually leads to your mind feeling a bit more refreshed and a bit more empty in that sense, and free from whatever the migraine is. So those are the kind of things that I'm doing at the moment. I think because it takes a long process to try and figure this out, I've tried various different diets as well. So I think the first thing a lot of people tell you is you try and eliminate chocolate, wine, and cheese. Those are 3 things that you have to try and eliminate. Now, chocolate and wine wasn't that hard for me. Cheese is the one that I find very difficult. And that means when you're trying to do things like you're trying to, go vegan, you're trying to stick to a vegan diet, it makes it quite hard. But what I've tried to do, because if you're trying something, you don't want to try it for a short period of time. You want to try it for 2 weeks. You want to try it for a month, for 3 months, for 6 months. And then you also want to try it without it as well. That gives you an idea where you can compare how you were feeling when you were on the diet and when you were off the diet during a long period of time. So I've tried various different diets. I've tried to reduce foods with high acidity as well, and I found all of these help. But again, even though it might seem like, oh, this person's not trying because they're not on that diet at the moment. I can tell you it's not the case. It's just, it takes a lot of discipline, and it's hard when you're in that zone to try and focus on these things. But I do my best to do all of that where I can. So yeah, it's an entire process when you have the migraine. I've been working for a while. I was at the same company for almost 4 years, and they were very helpful throughout the process. But unfortunately, I wasn't able to keep up my hours. So it wasn't working out with the role that I was in. I required a lot of time to invest into that role. I was working for a marketing and market research firm. And often it means you're taking work home with you as well. And I just wasn't able to produce the hours. So we kind of parted ways on that. And since then I've been doing, it's very difficult to often get back into work, right? Because you're back in the zone of you not being able to commit to the same hours. So you're deciding whether you can do something for yourself, what route you need to take now. Just for full disclosure, I have been doing sort of freelance work since then because it's more or less on my own time. But it's very hard. It's very hard. But I think the thing that people need to know is that, you need to try and take the positives when you can get them from this, because it can completely drain you and wear you out. So, take the positives from this where you can. And I guess that's sort of my experience. I'm not sure exactly what, maybe people want to hear, but that's my experience of it. So I guess I'll pass it back to you guys. And if there's any questions, obviously I'll still be here. So feel free to ask me.
Sahil, thank you so much for being so candid and open about this. And clearly there are a lot of challenges that this has presented to you. You mentioned a number of them in terms of the food, the employment situation and being able to work. And clearly you're quite resilient and you found your way around trying to kind of see what helps you. We'll hear a bit more about that perhaps in the Q&A, because we've got lots of questions already for everyone. But thank you for sharing that with us. And of course, I know you're not feeling great today because of a migraine. But, we'll talk a bit more. If you're able to stay for the Q&A, please do stay with us. And I'm going to now go to Heather, who's going to present to us the things about migraines, different types of migraines, the symptoms, the treatments, the challenges, and maybe we can kind of also reference some of the things that Sahil has just shared with us, Heather. So if you're ready, let's start.
Thank you so much for the introduction, and thank you, Sahil, for sharing your experience, especially on a day when you're not feeling very, very well at all. And I'm going to come back and talk about a lot of the points that you've already mentioned, because they're very common themes. Nikunj, can we share my slides? Thank you so much. So migraine is not just a headache, but it also is a headache. And I'm going to talk about both the pain aspects of migraine and then some of the other associated features, how we make the diagnosis, and what about the way to manage it, and ideas about that. Next slide, please. So first of all, we'll look at why it matters, what migraine is, comparing it with other things, how variable headaches can be, and how there can be really major differences in the types of migraine presentation and the various different types of treatments, some of which Sahil has already mentioned, and he's given you an idea of what's been helpful for him. Next slide. So migraine is by far the most common neurological condition. And in fact, it really is, it's as was said at the very beginning, most of us are going to get at least one migraine during our lifetime. At least 10% of us will suffer from regular migraines. And if you say compare that with something like epilepsy, where it's about 1% of the population, you can see how common it is. It's a leading cause of the need for people to take time off work, and it's one of the leading causes of disability in the whole world. And it is almost half of all of our neurological outpatient consultations are about migraine. and it can be sometimes confused with other conditions. And the most important thing to say about it is that treating migraine makes a massive difference. And the treatment starts with the person who has it, and with empowering yourself in the way that Sahil has been doing over the years that he's suffered from it, learning about it and being able to take control of aspects of it, which make it less of a burden. Next slide. So it's interesting when you think about what is migraine, to look at what the actual definitions, the sort of rigid definitions that are used in research, and then look at real life. And there is quite a difference. So the research definitions say that a migraine always lasts between 4 and 7 hours. It was worse with movement. It's often throbbing and on one side, and it's moderate or severe. And people may be nauseated, they may vomit, and they may be sensitive to light and sound. But there's a massive range in the manifestations of migraine, because sometimes it can occur on both sides of the head or be different in different attacks. And in some people, in fact, the actual migraine can be the headache can be quite mild. It can be very frequent, and unfortunately, it can become daily, as happened to Sahil for some parts of his migraine journey. And it can sometimes be less or more than the specified hours. Now, it can also occur with no headache at all. So you can have just an aura, or you can get pain, which is in the limb or in the abdomen. And that's particularly so for children. And that's a very, childhood migraine is really can be very different from the migraine experienced by adults. Next slide. So I think the definition that was used in the 60s, which was kind of looser and a bit freer, is probably a better definition for real life than the one we're using now. And that was recurrent attacks of headache that can vary a lot in intensity and the frequency and the duration, sometimes with changes in sensation, in motor function, that strength, and sometimes with mood disturbance as well. So the mood disturbance is not just that you are feeling bad because you've got a migraine, but you can actually get a change in your mood, which can either be a sort of a high feeling or a low mood, which is part of the aura of the migraine itself. Next slide. So I think that migraine is a bit like an ice cream. So you have the headache or pain in part of the body. You have changes in vision or sensation with some episodes. You can get pins and needles, so sensory change. You can get autonomic features. By that I mean nausea or vomiting. And as Sahil mentioned, you can get blocking or congestion of your nose, or you can be very pale. And being pale is a very common feature of migraine. If you have anyone in your family who has migraine, you may notice that they look really unwell. They've got dark lines under their eyes when they've got a migraine, and they just don't look their usual self. You can also get weakness with migraine, and there's a particular type of migraine called hemiplegic migraine, which means hemi meaning half and plegic means weakness, so you get weakness down one side. But under this is the cone itself, and that is that people with migraine are usually sensitive between attacks. In other words, people who have migraine will usually find that certain lights or sounds or sometimes motion can make them feel pretty strange even between attacks. And my son, who has migraine, used to find that if he went to a supermarket and those little things that little rides you can sit on, he would like to sit on the ride, but sometimes a friendly stranger would put money in the ride and make it go, and it used to make him feel really terrible and give him a migraine. So you can find that this sensitivity is there even when you're not having the migraine at the time. Next slide. So there are lots of different triggers for migraine. You can have like a time before the migraine building up to it, the actual aura, which is some sort of neurological change, and then there are also obviously treatments that can have an effect on the whole picture of it, of course. Now, Sahil mentioned some triggers, and he mentioned the importance of thinking about diet and so on. And just to mention that these triggers are very individual. So some people can have chocolate and and cheese and wine, and they don't get a migraine, and they might find that another food substance or another thing might seem to be a trigger. So it is very individual, and I think that if you're going to do look at your diet, it is going to be a matter of observing over a period, as was mentioned, for a couple of weeks, to see if there are any specific things that might bring it on, and then eliminating them and seeing if that helps. Next slide. So here are some of the triggers mentioned. In general, if you have migraine, the more regular your life is, the better. And that's not always possible or easy to achieve for us, is it? Life is not always predictable. But if you use a lot of painkillers that can trigger migraine, if you have alcohol that might trigger it, if you have lots of light or sound or certain smells may trigger it, and if you have irregular sleep patterns, if you miss meals, if you have stress or even relaxation from stress, all of those might trigger a migraine. So there's a big range of different triggers. And we've mentioned the fact that people with migraine, about 80% of us with migraine will be very sensitive to light. And that's used in some of the treatments, like certain stimulation techniques can use that to try and relieve it. Next slide. So sometimes people will find in the hours before they have a migraine that they get certain warnings that they're about to have a migraine. And this can be, I mentioned mood already. You might be more thirsty or hungry, or you might notice that you get very bloated before you have a migraine, and you might be more sensitive to light even before the migraine comes. And interestingly, epilepsy, which is another thing sometimes confused with migraine, again, something that happens in episodes, you can also get quite similar things that happen before the actual attack. Next slide, please. You're doing a great job there, Nukunj. Thank you. So we've mentioned the really vast number of different sorts of aura you can get. And aura simply refers to the neurological thing that goes along with the actual headache. So these can be weakness, there can be changes in your vision, and they can happen at various stages. So in some people, you can have the most common is to have the aura and then to have a headache. But in some people, they will just have the aura, or they can even have the aura during or even after the headache. So there's a very big variation in this. Next slide. So this is the most common of all auras, and I'm sure that some of us listening in the audience will have had this, lasting between 5 and 30 minutes, gradual onset and then going away of this visual change, typically a sort of a zigzaggy line on one side, and growing over time. And in fact, the person who drew this is someone called Lashley, who himself was a neurologist, and he had migraine, and he was quite obsessive because he actually plotted these different stages. You can see this is his drawing at different stages of time, up to 10 minutes when he got this zigzag line. Now, next slide. Now, there's a very rare variation of migraine, which I just mentioned because it's of historic interest, but also still happens now. And that is where you can get quite complicated visual hallucinations with migraine. And it's thought that Alice in Wonderland is actually a type of migraine aura where there was a distortion. You may see things that are bigger or smaller, or just changed of different shapes. And this can happen obviously with other conditions as well, but it can happen with migraine. And obviously, if you have this and you don't know what it is, it can be extremely frightening. Next slide. So a very common aura of migraine is tinnitus, ringing in the ears. And this we see very, very frequently. It's usually unpleasant, and it can happen in different relationships to the headache. And the important thing about it is if this is the cause, then treating the migraine will actually help and reduce these episodes of tinnitus. Next slide. Dizziness is a really common thing that goes along with migraine, and it's thought that about half of us who have migraine will have this, and it can last for minutes or hours. and it's really very unpleasant and can be quite a disabling feature of migraine. And I think this just highlights that if you have migraine, the headache itself may be the disabling thing, but other things that go around with it may be the biggest problem. Next slide. So very, very commonly people will have these autonomic symptoms, which I've already mentioned. And if you have a family who's seen you with a number of episodes, they can sometimes just know that you're having an episode and help you to get to bed or to take some painkillers and look after you. And these are really unpleasant. It's actually more common to get nausea rather than vomiting, but both can happen, and they can happen at any stage of the actual attack. Next slide. So tingling it can happen with migraine, and this is important because it can happen in some attacks as the only thing that happens. You just get tingling, and when I see people with tingling, if they have this, they're often concerned they might have another condition like multiple sclerosis, and be very worried about it. And this is more difficult because they may get this without actually having the headache on that occasion. But usually there will be other typical migraine headaches, at least with some of the episodes. So it's important to be aware of this. And in this situation, or where there is an aura that's very worrying, then we will do an MRI. But not everyone who has migraine will have an MRI, because it is a very common condition, and we can usually diagnose it just by the features of their symptoms. Next slide. So this is something that I think is really important, because people don't know about this very much. If you have migraine, almost half of people with migraine will have allodynia. And this is simply a description of an increased sensitivity of the skin. So the most common allodynia that occurs is if you get sunburn. So, if you've ever been sunburned, you'll know that your skin is extremely sensitive, even to light touch that shouldn't be painful. If you have a migraine, then lots of people will get this same symptom, this increased sensitivity of the skin. And that is a really key feature. It's very, very specific for migraine. Okay, so obviously we all think about migraine as being a headache, and that's a very, very important part of it. I mentioned that in both adults and children, although much more commonly in children, that you can get abdominal pain, or you can get limb pain, and so-called growing pains are usually a form of migraine. Be aware of that in your children, because we all know that migraine is very hereditary. So it's very, very common for people. If you have migraine, it's highly likely that someone else in your family will. Children often get a very raw deal with this, because they will have, the tummy pain or the growing pains, and people may think that they're trying to get out of school or some activity they don't want to do, and in fact they have migraine. And so just be aware of this as a really important possibility, so that they don't get the feeling that they're being thought of as being just trying to get out of an activity. Okay, next slide. So if we're just thinking of what the time course of migraine is like, it usually comes on gradually over minutes, can last for up to hours, and then goes away, usually with a headache. And if you think of other things like epilepsy or a stroke, they come on suddenly. In the case of epilepsy, they're brief. In the case of a stroke or a TIA, they can last a variable amount of time, but come on very, very suddenly. So it's all of these different features help us to build up a picture of what the diagnosis is. Next slide. I've mentioned the important variations, and I definitely won't go through all of them. I love this topic. It's so interesting. It's so important. There's so much we need to do about it, but I promise you I won't keep you up all night talking about migraine. But hemiplegic migraine is a really important one to mention. It is quite uncommon, but obviously extremely troubling and worrying. You get, as I mentioned before, weakness down one side. It can swap from side to side, or it can always be on one side. And this is thought to be something to do with the channels around the membranes of cells having a difference in the way they're working that can trigger these episodes. I've mentioned, and just to highlight again, you can get migraine without any headache, just a manifestation, a neurological manifestation. And don't forget childhood migraine. Be sympathetic if your children have these symptoms, and make sure they get good medical attention and pain relief. Okay, there are lots more variations. I won't talk about them all. Now, fascinating, I mentioned that 10 to 20% of the general population get migraine. People who work in hospitals, that goes up to 20%. Neurologists have up to 80% of more of us will have migraine. In headache specialists, it's more than 80%. And it's more common with certain other conditions, including epilepsy, which I have a special interest in. So this is interesting because it raises the point, is it this that, as a neurologist, I have migraine, and is it that I found it interesting because I suffered from the condition itself, or is it the other way around? And I think it's more that when you have knowledge about migraine, you recognize it more and you recognize the variations. So I think that neurologists have an increased awareness of some of the symptoms of migraine that may not be the most common type, and they can recognize it in themselves and in their families. Next slide. So I'm not going to go into this in any detail, except to say, quite honestly, we don't know exactly what causes migraine, but it has very strong hereditary factors, and it's to do with both changes in the blood vessels and also in the channels that I've mentioned with hemiplegic migraine and other types. And it's also to do with sometimes with changes in levels of serotonin and other transmitters. I won't say more than that because quite simply we don't have the full picture as yet, although we're learning more and more. Next slide. And this is just a way of trying to summarize some of the different areas of research looking at how migraine works. And the other very interesting one is about how when we do, say, acupuncture, we find that cells in the brain that respond to stimulating the face also are saying the same cells might respond to stimulation of the limbs. And this is probably why you can get limb pain or abdominal pain, and also why acupuncture works, because often acupuncture will use pressure points in the limbs to relieve it. Next slide. And so there are, over time and over our lifetime, we're learning more and more about genetic features of migraine and other neurological conditions. And a lot of these are to do with the channels. Over time, hopefully, this is going to help us to create more specific treatments for different types of migraine, to look at people's profile, genetic profile, and be able to target more specific treatments. Next slide. At the moment, though, there is lots we can do to help migraine, and we've had a really great explanation of some of the things that you can do. And I think the number one message from my whole talk is, if you have migraine or someone in your family has migraine, empower yourselves, learn about it, become an expert at it, because you'll be able to then help to steer your treatment. Most people in the world have never had any specialist information about migraine. Of those who have, it's often come from not from doctors, but from excellent sources of information on say the internet, or from pharmacists or other advisors, and they can give you very good information. Of course, beware that that on the internet there's always a mixture of incredibly good information and not so good information. Now, Sahil has mentioned already the importance of lifestyle, and that is really, to summarize it, of making sure that you have as regular a lifestyle as possible. So all the things that are good for us are going to help you with having less chance of having migraine. So sleeping the right amount, eating well, exercising, positive thinking, meditation, prayer, all of those things will help. Can we just go back one slide? No, sorry. Yes, that's it. Yes. So now, so a lot of people that I meet don't want to take regular medications, and the sort of things that they can use to help are acupuncture. And in fact, there is very good evidence that it works. You usually need to have about 10 sessions. And I guess the main things to say about it is really there are very few side effects of it. But if you don't like needles, and if you're really needle phobic, which about 10% of the population is, it's not going to be for you. And the other problem with it, from my point of view, is that we can't provide it on the NHS, and most people will have to pay for it. There are also now various external trigeminal stimulating systems that you can buy, and they again can be helpful, but again you have to pay for them. So some of these methods that are avoiding drugs are unfortunately not funded by the NHS. Next slide. Now, nutraceuticals, there's a lot, I love that word, I've recently discovered it. It just means vitamins and natural treatments. Magnesium, riboflavin, and coenzyme Q can be used alone or the three of them together. They are very safe, provided you don't go above the recommended amount, and they also they can cause cramping or diarrhea sometimes, but they're usually very well tolerated and don't have major side effects on the whole. Feverfew is a plant extract, and again, this could be very, very helpful. The only thing to say about feverfew is if you take it and then you're able to wean off it again, which we try and do with most of the treatments for migraine, you can get a sort of like a rebound effect of getting more headaches afterwards. Next slide. So then we come on to all of the different prescription drugs, and I'm definitely not going to go through these in detail, but when I see someone, I look at the range of different options that are available, and I've listed some of the main ones, and try and think of what's going to be the best that I suggest to the person, because they will all have certain benefits and drawbacks. For example, beta blockers like propranolol are very, very effective, but if you have asthma, then you can't take them. Some of the antidepressants at very low dose, not used to treat, not used in this case to treat depression, but used to treat migraine, can be really good. But it can make some people too sleepy, or they can have an increased appetite with it. So I won't go through all of these, but this is just mentioning some of them. So to summarize, migraine is really important. In the world, it causes a lot of disability. There's much more we could be doing for it, and we need more resources to do that. And hopefully over time, we're going to get more targeted treatments that are going to help people. But if you do have migraine, then there is a lot that you can do. And in fact, if you become an expert in it, you will be able to do a lot to help yourself. We've had someone who's very courageous and has spoken to us about their own experience, and I think given you a lot of insight. And this is really so important that you actually take control, and then you can start to explore all of the options. And as your GP, your pharmacist, and if necessary, your specialist can guide you and give you other options and discuss those with you. There are some very new treatments like botulinum toxin and injectable treatments that have just become available. They're quite expensive and they're quite limited. They're not better than the treatments we already have, but obviously some people are going to respond to one thing, and it's really good to have as many options as possible. So I'd be really happy to take questions, and I think I'll hand back to Prafula to take over. Thank you.
Thank you, Heather, for that really comprehensive look at what migraines are and how to treat them, what are the symptoms, and really sort of demystifying the whole subject for us, and bringing so much information for our viewers today. We have got a number of questions, so we're going to do a short Q&A session now, and Dushabha and I are going to facilitate this. And Sahil, thank you for staying. So we have got a few questions for you as well. People have been posting. to ask about how you're managing and some of the things you said. Couple of things you said, Heather, I just want to pick those up really quickly. You described a migraine as an episode and an attack, you know, and listening to you and knowing what I know, because I know a very good friend who has migraines, she cries in frustration, trying to kind of manage it. So I guess it is right to describe it as an attack, because it feels like you have been attacked, your body is being attacked. I didn't realize it is so common, and I didn't know that it is so much so people suffer so much that it is almost a disability for some people. So it's been really interesting listening to you and looking at the slides. We are going to start the Q&A. So Tushabai, do you want to go first?
Yeah, so thank you, Dr. Heather. Sorry. Just to inform you that obviously this is being webcast on YouTube, and Dr. Heather actually supplied so much information, and as a past pharmacist, retired pharmacist, even I've learned something today, yeah? So it was a lesson for me as well.
What did you learn? Get some sleep. You must get more sleep.
That's it.
Yeah.
But a lot of information digest, so every viewer will be able to watch this video in their own time and see all the slides and learn about it in a bit more detail. Because obviously, Dr. we are short of time as usual. So she's sped through a lot of information in this half-an-hour presentation, so that you'll be able to watch it in your own time. So without taking out too much time, one of the questions is, one of the viewers actually is prescribed naproxen, and he says it doesn't always help. Now, when he has a migraine, the pain goes down the neck and the back, and sometimes the migraine stays for 3 days, which you were explained about anyway, and it's there when he wakes up. So is naproxen suitable for a condition like this?
That's a really good question. So if you have a headache, so if you have migraine not very often, then painkillers can be extremely useful. As a rule of thumb, if you have less than 4 days of migraine a month, we usually suggest you treat each attack or each episode with painkillers, which can be naproxen or aspirin, or one of the specific treatments like the triptans, things like sumatriptan, which are prescribed. So yeah, it can be very effective, but clearly it doesn't work for everyone. So with all of the treatments, as Sahil said, you need to try them a few times, or try them over a period of 2 to 4 weeks at least, and do it in a very scientific way. Try something, see if it works. If it doesn't, then move on to another thing. The main thing about painkillers is if you're ending up taking lots every day, they won't work, and you really need to get medical help with that, because if you're taking them a lot, which is understandable if you've got a lot of pain, you need to then move on to taking some sort of preventive treatment. Okay, so you mentioned sumatriptan, which is the brand Migraine, and it comes in a nasal spray or injection. In your opinion, which is the better? I think that depends on preference. If you get lots of nausea with your migraine, then it's no good to take a tablet, because you won't absorb it. When you have migraine, you get a slowing of the stomach absorption, and the nausea is what happens with that. So if you've got a lot of nausea, an injection, a nasal spray is going to be better, or even some people will have an injection, or they'll have a wafer they put on their tongue. So it's an individual thing. Thank you, Prof. Leppan.
Thank you. So I've got a question, each one for Sahil and one for Heather. Sahil, so question for you is, somebody is kind of talking about the story that you described in your condition and how you're managing it. They want to know, when did you seek medical intervention and pain management, and what did the GP do? So what kind of tests did they do, and did they talk to you about your lifestyle and what you could do to help yourself, or how did that process start?
Yeah, sure. So I think, when was it? It was February 2019, I think I said. That's when I got the MRI done. So that's the first thing that they do. Or that's the first thing they did in my case anyway. They sent me off for an MRI. But prior to that, yeah, they did ask a bunch of questions. in all fairness, I mean, a lot of them were very vague. They were asking a lot of questions, but I think to go into detail, you probably do have to speak to someone like Dr. Heather or a neurologist, right? To get deep down to the issue of you as an individual. But it's exactly as she mentioned. The first things I was offered are, I think they are antidepressants, right? That's what they're classed as, triptans. So I think there was sumatriptan and amitriptyline. I tried them, I didn't like them, and my main side effect was that it would cause a lot of drowsiness. So all it's doing is really it would knock me out, and that's not solving the issue really. So I tried that. There was I was taking propranolol as well at one point, which is a beta blocker. And I've just found that in my case, these pharmaceutical drugs have not helped me. And I've tried to take things I've had to take things into my own hand in that case, which is doing all this sort of self-management that I've been doing. So one of the other things that I did ask to get checked for was, do I have asthma? Because I was feeling a lot of blockage in my nose or my sinus region. So I asked them to check that. They gave me I think it's the basic sort of blue pump that they give you. So I'm not asthmatic. They didn't diagnose me as that, but they said you can take this if you do feel like you're very out of breath at any point. And I've asked that because I know that there's a fair few people that I know who have had migraines, and it's often been solved by having some sort of minor surgery on your nose to do with the sinus region. I asked for these things, but in my case, during all the tests and whatever they've recovered from MRIs, they didn't offer that to me. But I think now that I've gone through everything, I've got to a stage where I went to see an ENT specialist, ear and nose, and they've advised that I could potentially look into something called a septoplasty, which is to help with I think it's to do with a deviated septum or something like that. And it's trying to open up your airwaves essentially to give you more oxygen going to your brain essentially. So these are the things that I've looked into, but yeah, the pharmaceutical drugs have definitely not helped me in my case. Yeah.
Thank you, Sahil.
With a couple of comments. So first of all, I think just to reinforce that Sahil's been very unlucky. And one of the things that we need to realize is that if you have bad migraine, it's not your fault. It's not that you've done something badly or you haven't followed the advice of the doctor. It's unlucky. So I think that's a burden that we need to make sure that people realize that it's one of those things. And you can see that the medicines that you tried, which were very reasonable things to try, unfortunately that didn't work, and you have to then move on and try other things. It's fascinating about the nasal congestion. You can get that with migraine. So just when you're analyzing that, make sure that that you don't do some sort of surgery, which might be actually a manifestation of the migraine. When you have the attack, you can get blockage of the nose. You can get that with other headaches as well. And also, if you're having difficulty with sleep and you're getting a lot of congestion, just remember about sleep apnea as well, which can make migraine worse, where people have obstruction of their airway during the night. And so they're very, very tired, and that can actually trigger or worsen migraine. So those are the things. And the final thing, lots of people who have migraine, as I mentioned before, won't have an MRI scan. And really the rate of having a brain tumor or something, if you've got headaches, is incredibly low. So just to reassure you about that, we would only do that if we had some sort of worry or about some of the other symptoms.
And sorry, just to interject there, I think based on the question you asked me, Prof. Leppan, I was also advised to potentially look into, there's various jabs that are available, right? So there's a Botox injection. There's also something called Ajovi, which was Ajovi Gravitas, I think is the name, and it was recently passed through NHS England. Dr. Heather, do you have any advice on these treatments? Because I think they're a little more frowned upon than some of the other drugs that people take, essentially.
Yeah, the only reason that the NHS frowns upon them is they're really expensive, which, as Tushar will attest to, that creates massive antibodies in anyone in the hospitals. So these treatments are actually, statistically speaking, no better. In other words, if you take 100 people, then you'll get the same response rate to those as you would to any of the other treatments. But as you've seen, Sahil, there is. Person A is going to respond to one treatment and another person is going to respond to another. So they're really useful treatments. At the moment, they're done in very specialized clinics because they're incredibly expensive. They can be extremely effective. but they're not more effective than the cheaper things. And we're always encouraged to try out the less expensive things first. I have to say that, otherwise I'll get into a lot of trouble tomorrow.
Thank you, Heather. So my question for you was, is there a link between the woman's monthly cycle and headaches or migraines, and which hormone is responsible? Can acupuncture help? Is it beneficial? So actually, those are two questions, aren't they?
Yeah. So that's a really good point. Certainly, the menstrual cycle can affect people, and usually just in the few days before or after is when they're in the maximum chance of getting migraines for women. But it's quite hard to use that as a way of therapy. In some people, we can give specific treatments around that time, and sometimes in specialist centers, they will use some sort of hormonal manipulation, because the question which hormone is responsible is really complicated. It's actually not one single hormone. It's just the balance of the different hormones that seem to be responsible, and probably something to do with the premenstrual sort of tension type symptoms. That's one thing. Acupuncture, it really works. The evidence that it works is as good as it is for all of the usual drugs that we use. It's very effective. The limitation in the NHS, which I mentioned, is that people often have to pay for it, and for lots of people in the world, that's simply, they can't. So if we could get that on the NHS, it would be really good. And of course, if you are going to have it done and you have to pay for it, make sure you're going to someone who's really good at it. Has been properly trained
and registered
yes. So you can get your GP perhaps, or you could look on the registered website, people who've got accreditation in it. Yeah. Or you can ask Sahil, he can give you recommendations.
Thank you. Tushar.
So a question for both of you. Just to let you know, Sahil is actually my nephew, and I've known him since the day he was born, obviously. Yeah. So, Sahil, you were prescribed salbutamol inhaler, which is Ventolin, the brand name, to open up your lungs, open up the nostrils, etc. Yeah. Now, have you looked at using essential oils like eucalyptus oil, lavender oil? Lavender is actually quite soothing. It's a natural product, and the natural products you just put in hot water and inhale that and see if that makes any difference.
So yeah, I have looked into that. I think often when you get ill or you're bunged up, you can do like a steam breathing, right? So often I would put I think it's Congoni. I don't know if that's the brand or the type of oil, but there's that. I've tried essential oils, so sometimes I put that into that as well. And there's some that you can get, right, which you can put. There's like a spray as well you can put by your pillow. So I've tried these products. It's all relief, right? Like it's short-term relief to try and get you to get to sleep or lie down or just feel that a little less pain. So yeah, I've definitely tried these products. Just since you've mentioned that, if we're talking about, in that category sort of products, I have also tried things like CBD bombs as well. I feel like they often help. So when my grandmother was around, we used to give her, because she had a lot of rheumatism, she had other joint problems and things like that, so we used to give her CBD bombs because we've tried everything and nothing's helping, and at that point in the later stage in life, all you want to do is give them relief. So I found that CBD used to give her a little more relief. We even gave her CBD oil, which would help her get better sleep actually and wake up less often in the night. So that sort of led me to trying that for my migraines as well, and I've seen very short-term sort of benefits from products like these. But yeah, oils and things like that, essential oils, yeah, I've definitely tried, and I can vouch for them in my case.
So the same question to Dr. Heather. What is the professionals' opinions of using these essential oils, which are naturally, obviously, occurring in nature?
Okay, so there haven't been a lot of studies of those that are sort of done in a rigorous scientific way. That doesn't mean they don't work, and they're not going to cause any harm. So they can be really useful. Again, I think they're part of this sort of battery of lots of different treatments we can use, and they're good to use. And they also will change your mindset if you use them in terms of relaxation and so on, and that's definitely going to be a help. I'm not implying that if you have migraine it's because you're tense or anxious. That's not the case. But if you do have migraine, it will often make you feel tense and anxious. And if you can reduce that, you can at least reduce the burden of the problem. In terms of cannabinoid oil, there's no evidence that it works in migraine. It's being touted as being good for everything. So I think that we need lots more research about what its place is going to be in treatment. But these responses are very individual. That's something that we can see with all these potential treatments.
Thank you, Professor Leppan. You're on mute. No.
You're not asking the next one. Okay. So the next question is, they're saying that they get throbbing pain on one side of the head. So their migraine is that. And then the severe headache, neck pain, visual problems. And then the headache gets better with paracetamol. Is there a home remedy they could try? So it's a similar thing to what Dusha was just saying, but is there like a home remedy that people could try?
Yeah, so as paracetamol, a simple treatment may help, and then in terms of the preventives, if this is happening a lot, more than say 4 times a month, then I would recommend the magnesium, coenzyme Q, or riboflavin, which do have good evidence, good scientific evidence of working. And one study suggests that if you use the 3 of them together, then they can be very effective. You need to stick to the recommended dose. And the only other sort of problem with them is you have to pay for them yourself.
So they're just vitamins from health shops, right? It's those 3 specifically that are very useful. They're on one of my slides, and with the doses that are recommended. So I think that they've got good evidence of working. Thank you. Tushabai.
I've lost my side, so can you take the next one? I'll just go on to the question.
Okay, so the next one's not a question, but we have a viewer, Lalita Mehta, and Heather, she says, "Oh, it's lovely to see you here. Years ago, I worked with you at Old Church Hospital in Romford." So she's saying hello. So the question we have is, what causes migraines?
Yes. I don't know. I've been studying them and looking after people with migraines for a long time. We don't know. They're a combination of changes in the transmitters in the brain, in the vessels, inflammation in the blood vessel wall. But I think they're actually the manifestation of a biological something, a backfiring of a biological mechanism. My hypothesis is that people with migraine have an increased sensitivity to all sensations, to light, to sound, and the same pathways that we perceive the most beautiful things, music, the most beautiful picture, are the same pathways for that are pathways for pain. So if you think in a biological sense, when we were in the wild, being hunted and hunting, the more sensitive we were to the environment, the better our chances of survival. So I see this as something that's slightly backfired. These pathways that are very heightened and we're very aware of these sensations can sometimes backfire, and you can get pain passing through exactly the same pathways. So I think that's how I see it, but we don't have an answer. People who say there's one mechanism that goes, it's all to do with blood vessels, or it's all to do with CGRP, or it's all to do with one transmitter, I think that's not true. It's complicated, and it's a matter of some change in this subtle balance between all these different transmitters and vessons.
And of course, you've done a lot of research in this area, Heather, or you've been part of research projects. So does research continue to try and find more about this and find more treatments?
Yes, absolutely. So they're the 2 arms of the research. There's looking at the mechanisms, hoping that you'll get then clues which have led to advances like the new CGRP antagonist injections, like the one you mentioned, Avamig. Or at the same time also just trying different treatments in a very standardized way and seeing, you know, whether they really work or not. So they're sort of coming at it from both angles.
Thank you. Tushar bhai.
Okay, so this is a viewer called Hava. This is a recommendation for Sahil. Have you done Anulom Vilom Pranayam? So basically, it's alternate nostril breathing. So you breathe in through, you shut one nostril, breathe out, breathe in, deep breathe in, and then when you breathe out, you breathe out through the other nostril. Yeah, and do that for 30 minutes. Yeah, so this recommending that for you to try. See if that makes any difference.
Yeah, thanks, Hava, for recommending that. I have actually been doing that.
Okay.
And that's part of my core breathing. Okay. There's a few other names. Anulom Vilom is the only name that I actually know, but there's names for the other ones. I think one is called Pranayam, and I think there's some other ones. I have that as part of my. No, it definitely helps. It's good.
Good, yeah. Good. Yeah. So we got viewers obviously who have the utmost thoughts for you in their minds and giving you some other ways of treating this migraine.
That's great. Thanks.
So obviously there's some foods, bananas, cheese, coffees, etc., which does trigger different people get triggered by different aspects, yeah, which Dr. Heather talked about anyway, yeah. There's a question, what causes it? That was all in your slideshow. It could be various factors doing all of that. Hormonal changes, I think you talked about, yes? Yeah. Okay, is there a link between migraines and obesity? So there was a viewer who actually says that used to suffer from migraines, and after some weight loss, he finds that the migraine has decreased substantially.
That's really obviously that's going to be good for general health. The indirect link is what I mentioned about sleep apnea. Sleep apnea can happen to thin people, but it's more common in people who are overweight. And that's when there's an obstruction of your airway during the night. So you snore very loudly, you might have gaps in your breathing. If you have that, then your migraine will often be worse. And if you lose weight, then you can get rid of the sleep apnea or reduce it a lot. So that could be a mechanism for why that was so effective. But yeah, obviously everything we do for our general health is going to help migraine, even if it doesn't stop the headaches or the symptoms completely. It's going to help us to cope better. And I think Sahil's been a very good example of using a whole life approach to reduce the burden of the problem.
Thank you. Professor Leppan?
So I've got a question, says, I've recently been diagnosed with hemiplegic migraines. I previously suffered from migraine with aura, and I've opted for alternative herbal treatments, which have really helped. So they're just sharing that with us, that the alternative herbal treatments have helped them. Someone is saying the side effects of some of the medications, like we talked about, drowsiness and lightheadedness, sort of brain fog. So that's one of those side effects, and they're just confirming that. And then I've got a question which says, what about a plant-based diet? This comes up every single webinar, doesn't it? Somehow everyone thinks plant-based diets always comes up in these webinars. So what about a plant-based diet, Heather?
For some people, as we mentioned, the food triggers are very specific. For some people, a plant-based diet will help reduce or even eliminate diet. I've had patients who've gone onto a gluten-free diet and have stopped having migraines altogether. It is very individual. One of my grandmother's favorite saying was that everything in life that's any fun is immoral, illegal, or fattening. So I don't want to be the bad cop that's telling people they have to give up everything that tastes nice. So I think if you are going to do sort of like an elimination diet or change in diet, do it, as we've said, in a rigorous way. You don't, if it's not working, then go back to what you like eating. If it does work, then that's fantastic. You know that, and you can be better without having to have extra medications.
So is that a process of elimination? Because Sahil, you talked about food, didn't you? And you said cheese, wine, and chocolate. And so how did you know which one was triggering and which one was helping?
So those were the first three things that the GP said to me. Try and
The GP said, okay.
Yeah, that's one. Yeah, so actually, to one of your earlier questions, yeah, that's one of the things that they advised as well. And I found when you once you get a migraine, you're speaking to more people with migraines. So a lot of them say the same thing, that this is one of the first things that they get told, as far as diet goes, anyway, to consider. But I think to one of the comments that one of you made there as well, you've kind of got to enjoy life as well. Sorry, I think Dr. Heather, you said that as well, and that's sort of you've got to take the positives. And the irony is that you could be needing a vegan, like a plant-based diet to try and have a happier life, but at the same time, when you're going through all these downturns and you're having such bad migraines, you need something to uplift you sometimes. So it's a tough one, but I've tried it, and I found on days where I'm doing the opposite of what I should be doing, I'm having a fantastic week. I could be having all the pizza. I could be having a lot of cheese. I love chili paneer. I could be eating a lot of chili paneer. I could be sleeping late on those days as well, having a very irregular sleeping pattern that week, and I wake up great. And then I'm doing everything that I'm told to be doing. And this is why I can't seem to figure out why I'm having these migraines. Nothing makes sense. So it's one of those situations. Yeah.
Thank you. Tushabai.
Yeah. So, Dr. Heather, you talked about different medications, propranolol, amitriptyline, etc., all these other medications. Yeah. You talked about coenzyme Q10, feverfew, etc. Is there any benefits in homeopathy, or has any research been done on homeopathic medication?
There's not very much, and also I guess that in my training, it's not really explored homeopathy very much. So I have to plead ignorance about I don't know a lot about it. But there hasn't been a lot of very vigorous research done in that because no one has funded it, basically. So we don't really know. But for some people, it's going to work because the range of different treatments that will work for individuals is very wide. So if it works, that's wonderful.
Yeah. Have you explored homeopathy with any specialist?
Do you mind explaining what homeopathy is exactly?
How can I explain homeopathy? Dr. Heather will be a better one to explain.
Yeah, so homeopathy is using very, very tiny concentrations of substances, usually based on natural substances, very, very tiny doses, way below what we would tend to use in pharmacies or in hospitals.
If that's to do with Ayurveda, then I have taken some things a bit similar to that.
No, it's slightly different.
It's different, actually.
So assuming cheese gives you migraine, for argument's sake, yeah. So in homeopathy, that give you very minute dose of cheese in a tablet form,
okay,
to get your body used to it, yeah. And that's, in simple terms, that's the aggravating factor. They give it to you in a very minor dose. That's what homeopathy is, and it comes in different strengths. Yeah, I'm not an expert, but there are people who literally believe in homeopathy, and it does work for them. Yeah. And there are specialist practitioners on homeopathy who have studied quite detailed, just like Dr. Heather would have studied her subject. Yeah. So there are other specialists out there.
Yeah. So homeopathy is something I haven't tried. I think I'll look into that more now that you've mentioned it. One of the areas I have tried though is reflexology. Yeah. And I think the idea is that all your nerves are connected from your feet to your head, and the other way around, of course, as well. It's painful though, but it's I found some relief from that. And there's little things that I do here or there, just while we've got it's a great platform to let people know some of the other things that I've been doing as well. So, and they might sound silly, but I've in the morning I try and do a handstand or a headstand, and it's to try and get some blood going. It could be a placebo thing. It's something in my head, but I found that with, even if it is a placebo, it gives me some relief. So if it helps me, why would I not do it? So there's things like that. I bought an air purifier to try and clear, the air in my room when I'm sleeping, especially. I'm hoping that helps me. And I think it's worth seeing your optician as well, actually. I don't know if that one's been mentioned, but a lot of us work in office environments. You're on the screen a lot, whether you're at work and once you're back at home. So I'm not wearing them right now, actually. I've got glasses that I wear when I'm on the screen for a long period of time. It's got a blue screen filter, and that's meant to help as well. So yeah,
that was actually mentioned by Bhavin when he did the eye care session with us, in one of our webinars way back. And absolutely, that can also cause those sort of eye strain headaches, can't it? I have one final question. Unless Tushapa, have you got any more? Because I've got one.
I've got. Well, you take that, and I'll do the last one. Yeah.
Okay. So, can menopause be a trigger?
Yes, it can be a trigger. The worst sort of menopause in terms of triggering migraine is if you have a surgical menopause. In other words, if for some reason you have to have your ovaries removed because you might have, say, endometriosis or cancer or something, and so you suddenly have a loss of all of the hormones. That can trigger very bad migraines. With natural menopause, you can also sometimes see a worsening of the migraine. Most commonly, it's worse for a while and then gets better again. But you can do things to help over that period. Yeah.
Thank you. We are going to explore menopause actually in one of our future sessions. So that would be good to kind of connect to this as well. Tushar, hi.
So somebody is saying that they've found acupuncture and cupping, and this has helped their episodes, which is fantastic good news. And viewers asking, can my hemiplegic migraines be resolved, Dr. Heather?
Yes, hemiplegic migraines can be resolved. I think we try the same treatments as we use for other forms of migraine, and usually you can improve them. On occasions they can be more difficult to treat, but they can still be improved and resolved. Yes.
Excellent. And there's a viewer who's actually said that he's found homeopathy to help him. As he especially didn't want to take conventional drugs, which is good news. And this is something that you touched on, Dr. Heather, that there are so many different treatments, and there is not one magic one which will benefit every single patient. It's a matter of trial and error to find which is the most suitable for you, what's causing it, So
that's a really good point. So I think you have to think of this as a journey. You're the pilot. It's you that has this. You try things in a logical way, in a stepwise way, and if you do it logically and you keep trying, you can usually find a way of improving the situation or hopefully resolving it altogether.
Thank you.
If I can just add to that, I've sort of found that during the start of my journey, I used to think there was only one thing that I could find and that would help me. Sometimes I've often found that it's now the case that it will be a combination of things that you will need to do or not do in order to try and have some relief of your migraine. So I think to any viewers who do have migraines, and correct me if I'm wrong here, but this is sort of my case. Try a few things. Don't just have the expectation that it's just one thing that will solve all of it. So yeah, I just wanted to interject with that.
That's it. Professor Leppan, for you to
Brilliant. Thank you. That was a lot of questions and some really brilliant explanations and information that we've shared with everyone. So I want to say a big thank you to Sahil for persevering and joining us and staying to the end and answering those lovely questions from lots of people. So I'm sure that's helped a lot of people. Heather, thank you again for taking out time out of your really busy diary and joining us again, because you're a visitor second time to the Oshwal webinars. And it's been really interesting to explore this topic. Next time, we're going to be back on the 24th of March. So these webinars are going to be monthly now. And we're going to be talking about cancers and particularly prostate cancer. So please join us again. And thank you everyone that has joined us this evening. Things are starting to get a bit busier for people, but beauty of these webinars is that it is on YouTube and people can watch them in their own time. And there's so much really good information that we've shared with everyone today. So I hope that people will tell each other and do look at the YouTube webinar. And of course, Heather's slides are on there, Sahil's information's on there. So I want to say thank you to everyone for joining us. Tushabai, thank you once again, as always. And we'll do it all again on the 24th of March. Thank you very much, Jai Jinendra.
Thank you.
Thank you.